A yellowish hue understanding jaundice. Jaundice is a condition that makes your skin and the whites of your eyes turn yellow. This happens when there's too much bilirubin in your blood. Bilirubin is a yellow pigment that's made during the normal breakdown of red blood cells. Usually, bilirubin passes through the liver and is eliminated from the body. But if there's a problem with your liver or bile ducts, bilirubin can build up in your blood and cause jaundice. Jaundice can affect people of all ages from newborns to older adults. In this essay, we'll explore the causes, symptoms, treatments, and preventive measures related to jaundice. Behind the yellow mask, unveiling the symptoms. The most noticeable symptom of jaundice is the yellowing of the skin and the whites of the eyes. This yellowing, also known as icterus, is often the first sign of the condition. Beyond the discoloration, you might also experience other symptoms, such as dark urine, which may appear brown or tea-colored, pale stools, which may be light yellow or clay-colored, itchy skin, which can be caused by bilirubin buildup, and fatigue, a general feeling of tiredness and weakness. If you notice any of these symptoms, it's crucial to seek medical attention promptly. When the liver falters, jaundice and liver disease. The liver is a vital organ that performs many essential functions, including detoxifying harmful substances, producing bile to aid in digestion, and processing nutrients from the food we eat. One of the most common causes of jaundice is liver disease. Jaundice itself is characterized by a yellowing of the skin and eyes, which occurs when there is an excess of bilirubin in the blood. The liver plays a vital role in processing bilirubin and removing it from the body. Bilirubin is a yellow pigment that is produced during the normal breakdown of red blood cells. Normally, the liver processes bilirubin and excretes it in bile. When the liver is damaged or diseased, it may not be able to effectively process bilirubin. This impairment can be due to various conditions that affect the liver's ability to function properly. This can lead to a buildup of bilirubin in the blood, resulting in jaundice. Symptoms of jaundice can include yellowing of the skin and eyes, dark urine, and pale stools. Several liver diseases can cause jaundice, including hepatitis, which is inflammation of the liver, often caused by viral infections. Hepatitis can be acute or chronic and can lead to significant liver damage if not treated properly. Cirrhosis, which is scarring of the liver, often caused by long-term alcohol abuse, is another major cause of jaundice. Cirrhosis can also result from chronic hepatitis or other liver diseases. Liver cancer, which involves malignant tumors in the liver, can also lead to jaundice. This type of cancer can be primary, originating in the liver, or secondary, spreading to the liver from other parts of the body. If you have jaundice and your doctor suspects liver disease, they will likely order blood tests and imaging scans to assess your liver function and diagnose the underlying condition. These tests can help determine the cause of jaundice and guide appropriate treatment options to manage the liver disease effectively. Obstructed pathways, bile duct blockages, and jaundice. These conditions can significantly impact your health and well-being. Bile ducts are small tubes that carry bile from the liver and gallbladder to the small intestine. This bile is crucial for the digestion and absorption of fats in our diet. Bile helps with digestion and the absorption of fats. Without proper bile flow, the digestive process can be severely disrupted, leading to various health issues. When bile ducts become blocked, bile can't flow properly and may back up into the liver. This backup can cause significant damage to the liver over time. This backup can interfere with the liver's ability to process bilirubin, leading to jaundice. Jaundice is characterized by yellowing of the skin and eyes, and it indicates a serious underlying issue. Several factors can cause bile duct blockages, including gallstones, which are hardened deposits of digestive fluid that can obstruct bile ducts. Gallstones can vary in size and may cause severe pain and complications if not treated promptly. Tumors, which are growths that can compress or block bile ducts, can also lead to blockages. These tumors may be benign or malignant, requiring different treatment approaches. Pancreatitis, which is inflammation of the pancreas, can narrow or block bile ducts. This condition can be acute or chronic and often requires medical intervention. Treating bile duct blockages often involves procedures to remove or bypass the obstruction. These treatments can range from minimally invasive endoscopic techniques to more complex surgical interventions, depending on the cause and severity of the blockage. Section 5. Red blood cells under attack, hemolytic anemia, and jaundice. Hemolytic anemia is a condition in which red blood cells are destroyed faster than the body can replace them. This rapid destruction of red blood cells can overwhelm the liver's ability to process bilirubin. As a result, bilirubin levels in the blood can rise, leading to jaundice. There are various causes of hemolytic anemia, including autoimmune disorders, where the immune system mistakenly attacks red blood cells, certain infections that can cause red blood cell destruction, and genetic disorders that affect red blood cell structure or function. Treatment for hemolytic anemia depends on the underlying cause and may involve medications, blood transfusions, or other therapies. Section 6. Newborns and jaundice. A common occurrence. Jaundice is common in newborns, especially in babies born prematurely. This is because a baby's liver is still developing and may not be able to efficiently process bilirubin. In most cases, neonatal jaundice is mild and resolves on its own within a week or two. However, high levels of bilirubin can be harmful to a baby's developing brain. Treatment for neonatal jaundice typically involves phototherapy, in which the baby is exposed to special lights that help break down bilirubin. In more severe cases, an exchange transfusion may be necessary. Section 7. Combating jaundice treatment options and considerations. Treating jaundice involves addressing the underlying cause. If liver disease is the culprit, treatment may involve medications to manage the condition and prevent further liver damage. For bile duct blockages, procedures such as endoscopic retrograde cholangiopancreatography, or ERCP, or surgery may be necessary to remove or bypass the obstruction. Hemolytic anemia treatment depends on the underlying cause and may involve medications, blood transfusions, or other therapies. In addition to treating the underlying cause, supportive care measures can help manage jaundice symptoms. These measures may include staying hydrated by drinking plenty of fluids, eating a healthy diet that's easy on the liver, and avoiding alcohol and drugs that can further damage the liver. Section 8. Preventing jaundice. Lifestyle changes and precautions. While not all causes of jaundice are preventable, certain lifestyle changes and precautions can reduce your risk. Get vaccinated against hepatitis A and B. Practice safe sex to reduce your risk of hepatitis B and C. Limit alcohol consumption to protect your liver. Maintain a healthy weight to reduce your risk of gallstones and liver disease. Avoid exposure to toxins that can damage the liver. Be cautious about using over-the-counter medications, as some can harm the liver. If you have any health conditions, follow your doctor's recommendations for managing them. Section 9. Recognizing the signs, early detection of jaundice. Early detection of jaundice is crucial for prompt treatment and better outcomes. Pay attention to your body and seek medical attention if you notice any of the following: yellowing of the skin or the whites of your eyes, dark urine, pale stools, itchy skin, or fatigue. If you have any risk factors for jaundice, such as a history of liver disease, gallstones, or alcohol abuse, be especially vigilant about these symptoms. Section 10. Seeking medical advice. When to consult a doctor. If you suspect you or someone you know has jaundice, it's essential to consult a healthcare professional promptly. Early diagnosis and treatment can make a significant difference in managing the condition and preventing complications. Your doctor can perform a physical exam, order blood tests, and recommend further investigations or treatments as needed. Section 11. Conclusion. Shining a light on jaundice. Jaundice, a condition characterized by yellowing of the skin and eyes, arises from an excess of bilirubin in the bloodstream. This yellow pigment is produced during the normal breakdown of red blood cells. When the liver cannot process bilirubin efficiently, it accumulates, leading to jaundice. Its causes range from liver diseases and bile duct blockages to hemolytic anemia and neonatal factors. Liver diseases such as hepatitis or cirrhosis can impair the liver's ability to process bilirubin. Blockages in the bile ducts prevent bilirubin from being excreted, while hemolytic anemia increases the breakdown of red blood cells, overwhelming the liver's capacity. Recognizing the symptoms, understanding the causes, and seeking timely medical attention are crucial steps in managing jaundice effectively. Symptoms can include yellowing of the skin and eyes, dark urine, pale stools, and itching. Early diagnosis and treatment can prevent complications and improve outcomes. While not all forms of jaundice are preventable, adopting a healthy lifestyle, getting vaccinated, and being mindful of potential risk factors can significantly reduce your chances of developing this condition. Regular exercise, a balanced diet, and avoiding excessive alcohol consumption can support liver health. Early detection and treatment are paramount in ensuring the best possible outcomes for individuals with jaundice. Diagnostic tests, such as blood tests, imaging studies, and liver biopsies can help determine the underlying cause and guide treatment. Remember, knowledge is power, and being informed empowers you to take control of your health and well-being. Stay educated about jaundice and other health conditions, and don't hesitate to seek medical advice if you notice any concerning symptoms. Your proactive approach can make a significant difference in your health journey.